Hey guys, my name's Steven, and today we're going to be discussing bowel basics, so let's get started. First things first is probe selection, like always. So the two probes that I use for bowel ultrasound are the curvilinear probe and the linear probe. Now, the curvilinear probe I usually use for diagnoses like small bowel obstruction and diverticulitis. It's a good way to kind of survey the bowel and see if there's any gross abnormalities. The linear probe is much more useful for looking at small structures like the appendix. Granted, you do have to have a fairly skinny patient to be able to image the appendix with the linear probe, since the depth limitation is, 5 or 6 centimeters. Whereas the curvilinear probe, you can see much deeper. Now, when it comes to technique, it really depends on what you're looking for. So for SBO, I use this lawnmower technique. And basically what that is scanning back and forth up the abdomen in an organized fashion so that you don't miss any quadrants where you could have dilated abnormal loops of small bowel. And then if you're looking for something like diverticulitis, I usually ask the patient, where is their most painful spot? I put the probe right there and look for the findings that I'm suspecting to see with diverticulitis. When I'm looking for appendicitis, I kind of use the anatomy to help me. So I find the cecum, I find where that connects to the terminal ileum, and then generally the appendix comes off adjacent to those structures, so that helps me find that. Although we're not really talking about pathology today, I just wanted to give you guys an idea of how to approach the actual technique of scanning for bowel, because it really does depend on what you're looking for. Now, the hardest thing I find when people are starting out is just identifying the structures they're looking at. And I think the first key step in that is recognizing where the peritoneum begins. So we'll cover this concept now, and then we'll review it in a few minutes to make sure that you really understand it. So here, if you look at this image, we have a lot of tissue here, and deciding where the peritoneum starts is the first key point to being able to recognize whether or not you're looking at bowel. So this is actually the rectus muscle here. And when I start the clip over, you're going to notice that it does kind of look like, like meat, like a muscle. And so you should be usually looking right behind that, and this is the peritoneal line. And you notice as we kind of fan up, the peritoneal line moves, and that's because at different spots, the rectus muscle is going to be either thicker or thinner or less obvious. So we'll come back to this and make sure you can identify the peritoneum. But first, we're going to talk about the layers of the bowel wall. So when we're looking at the bowel, the way that is easiest to remember is that you're going to have two black lines with a white line in between. That's the walls of the bowel that are always visible. This is the complete segment of bowel that you can see on ultrasound, which is white, black, white, black, white. And here we have the stomach with all the layers visible. This is very atypical to see this, but just know that when you do see this, these are all the layers of the wall, and this is the lumen. This is more typical of what you'll normally see when you're doing bowel ultrasound. You should see that black-white sandwich. So you see a black line with a little thin white line in the middle and another black line below it. So that's what we're seeing here with this layer 4, 3, and 2. So that's the muscularis layer, submucosal layer, and one more muscularis layer. And those three are always going to be visible when you're doing bowel ultrasound. So now let's look at this image. Couple things while this is playing. You want to identify first the peritoneum, where that begins. And now look right past the peritoneum. And now you know you're looking at intra-abdominal structures. And try to see if you can identify some loops of bowel in there. So I'm going to bring up the next image, which will show you where the peritoneum is. So there's that rectus muscle, there's the peritoneum. We'll watch that clip one more time. Right? And you can see that peritoneal line actually moves up as we fan through there. And now let's look at the next image that's going to show us the layers of bowel wall. So still here, we have that same image where we have that black, white, and black sandwich where we have a thin white line between two black layers. And now let's play that clip. So you can see at the beginning of the clip, you can clearly see that thin white line between two black layers, which represents a bowel wall. But then at the end of the clip right here, you're mostly just seeing one single muscularis layer. You do see a little tiny black line under that mucosal layer, but a lot of times you do just kind of see this white with bowel content. But just remember that usually the bowel wall starts with that black muscularis layer first. So include that in any measurements you're looking for pathology of bowel wall thickening. The last concept I want to cover with you guys is looking at large bowel versus small bowel. So large bowel has this haustra here. So whenever you see these invaginations, you know that you're looking at a loop of large bowel. While small bowel is usually kind of flat. So here we have that flat line there. And now if you have a bowel obstruction, you can actually differentiate what portion of small bowel you're looking at based on how it looks. But we'll cover that more in the pathology lectures. But for now, just notice that you can tell the difference just by noticing these haustra. that's pretty much it for bowel basics. I think getting out there and practicing looking for bowel is the most important step first. And then after that, you can get better at looking for things like diverticulitis and appendicitis and small bowel obstruction. Thanks, guys.